Every year, thousands of people are diagnosed with cancer. If you or a loved one are among them, you're not alone. Medical research has yielded many methods of treating cancer. Depending on your diagnosis, your doctor may recommend chemotherapy as a treatment for you. Chemotherapy is a drug or a combination of drugs that fight cancer cells by slowing or stopping the growth of cancer. Most people find the thought of chemotherapy frightening, but learning all you can about the treatments will help calm those fears. In this video, we'll show you what you can expect when you go for your first chemotherapy treatment. You will be visiting one of the Norris Cotton Cancer Center locations, depending upon where you live. And each are designed to provide you with the comprehensive cancer services to meet your needs. So let's begin. Chemotherapy is given in a very precise manner, and it requires your active involvement. So be sure to follow all your treatment team's instructions. Your doctor or nurse practitioner may prescribe certain medications for you to take before you arrive for your treatment. Typically, there are no eating or drinking restrictions before your chemotherapy. We even provide light refreshments to patients during their treatments. The cancer treatment team will need to know the names and strength of any medications you're taking. So it's a good idea for you to write them down at home and bring the list with you. When we know what medications you're taking, we can prevent any unwanted drug interactions during your therapy.
Hi, Elizabeth. I hate to bother you, but I just went to see my primary care physician, and I was wondering, she wants to put me on an antibiotic.
If your medications change during your months of treatment, you must tell your cancer center doctor or nurse immediately, since these changes may affect your chemotherapy. You will probably need someone to drive you to and from the infusion suite, since the treatments can cause dizziness or nausea. Check with your treatment team to see what they advise. When you arrive at the Norris Cotton Cancer Center, you will check in with the receptionist.
Hi, Mary.
Hi, how are you?
You may need to have blood drawn for lab work, or see your doctor or nurse practitioner before going into the infusion suite for your treatment. After this visit, you will return to the main waiting room until the nurse calls you.
Mary?
Your infusion suite nurse will bring you to a comfortable bed or chair and get you settled for your treatment.
My name's Sandy. I'll be your nurse for today.
There is a visitor's chair available, so a friend or family member can keep you company during your treatment. We ask that patients have no more than one visitor in the suite at a time. If a family member or caregiver is sick, they should not come with you to the cancer center because patients being treated for cancer are more likely to catch colds, flu, or other contagious diseases. The infusion suite is not an appropriate place for visiting children.
Could you tell me your name and date of birth, please?
Mary Turner, 1238.
So the catheter.
Okay, what is that numbing medicine?
Lidocaine.
Okay.
Feel free to ask questions at any time during your treatment. Aside from your doctor, your treatment team includes a chemotherapy nurse, a pharmacist, and other experienced professionals who work with many cancer patients each year. The staff is highly professional, and they make sure that each patient is receiving the proper dose of the medication that has been prescribed. At the treatment center, you'll often hear the word chemotherapy used interchangeably with infusion. Infusion is the process by which most chemotherapy drugs are delivered into your system.
Okay, you're going to feel a little pick and a burn just under the skin.
The nurse will insert a small needle or IV into your hand or arm or into your IV port if you have one. The drug will be infused into your bloodstream through this needle or IV line. The chemotherapy drugs may come in a bag, bottle, or syringe. The infusion procedure itself should not be painful. If you feel any pain or discomfort, tell the nurse immediately. You'll find that the infusion suite is a friendly and supportive place. Everyone is committed to helping you get through your cancer therapy with the best possible result. Your blood pressure, pulse, and temperature will be taken before and after your infusion. The amount of time you spend at the center will depend on your treatment program. Treatments can range from minutes to several hours, depending upon many factors, such as the need for lab work, a visit with a doctor or nurse, or the time it takes to prepare and administer the drugs. Be sure to bring something to help you pass the time, like a book, computer, music player, or a friend. Free Wi-Fi is available. We have TV sets at each chair and bed, and we can provide you with earphones if you need them. Chemotherapy affects your blood cells, so once you've had your first treatment, you'll routinely have your blood tested. This is done to make sure your white blood cell count and your platelet count are high enough for you to safely tolerate your next infusion. White blood cells are important because they help fight infection. Platelets clot your blood. Red blood cell counts are monitored as well because a shortage of red blood cells can lead to anemia and fatigue. Chemotherapy may even be delayed or stopped if your blood levels are not where the doctor wants them to be. There are treatments available to increase white blood cell counts if necessary. Chemotherapy works by fighting the cancer cells in your body, but it might also attack some healthy cells. This means you can expect to experience some degree of side effects after your infusion. You may experience nausea, vomiting, diarrhea, or constipation. Other side effects that may follow treatment include fatigue, muscle pain, or skin rash. It's not uncommon to feel numbness, tingling, or a burning sensation in your hands and feet as a result of your chemotherapy. Different chemotherapy drugs can cause different side effects. Sometimes your fingernails and toenails may change color, become thin, loosen, or break easily. Since chemotherapy fights rapidly growing cancer cells, it can affect other rapidly growing cells, such as hair follicles. After the first few weeks of treatment, you may possibly lose the hair on your head as well as eyebrows, eyelashes, and body hair. This won't happen to everyone, since the treatments are different for each patient. Your hair usually grows back once you've completed all your treatments.
Very nice.
Your medical team has treatments available to help you through many of the side effects. The important thing is to be aware of possible side effects and to report them to your doctor or nurse so they can do their best to help you through them. You should notify your doctor or nurse practitioner if you have a fever of 100.4 degrees Fahrenheit or higher, any signs and symptoms of infection, unusual bruising or bleeding, unusual dizziness, lightheadedness, or shortness of breath. Also, report excessive fatigue, nausea, vomiting, diarrhea, or constipation lasting more than 48 hours after chemotherapy, mouth sores, white patches in your mouth, or painful swallowing. We hope this video has given you a sense of what to expect from your chemotherapy treatment. If you have additional questions, please ask your doctor. Remember, chemotherapy is designed to help you win your battle against cancer. Your entire chemotherapy team is on your side.